This is Brian Terrian here, and thank you for listening to this interview today. Just wanted to preface what we're going to cover in this is really for people that are looking for a business, something to do from home for work that's reliable, dependable, it's not impacted by the economy. Or if you're a Social Security disability representative and you have a client base, or a CPA or an accountant or some other type of professional that is looking to maximize your client base and your income, this is definitely something that may be a fit for you. So in my experience here at the Disability Digest, we have been helping individuals get and maximize their disability benefits since 2006. And I'm doing this interview and this effort today because this estimated 9 million people are certainly underserved, and we're going to cover that here today. So my guest speaker today is Mark Snihurowych. Mark, thanks for joining today.
Thanks for having me.
I have known you for about 3 years now, and I'm still very diligent about pronouncing your last name, or attempting to pronounce it correctly, so I hope I've done it some justice.
Perfect, thank you.
Yes. So for those of you listening, Mark has been in the Medicare healthcare space for quite some time, since 2013 to present. He is the president of Disability Health Advocates. And here's the reason why I'm excited to have you do this interview with me. If, in my experience in the Social Security disability world that I've lived in for business, there's one person out there that I can confidently say has taught more people to capitalize on their income opportunity with their Medicare business, and that's you. I mean, what you've done with disability attorneys, non-attorneys, helping them understand the value of their business and how to capitalize on it, what you've done with us here at the Disability Digest. And I know you've done it with CPAs, you've done it with accountants, so thank you for taking the time.
I appreciate that, thank you.
Yeah, it's not easy work, that's for sure. So first of all, this is what I'd like to start with is, and I'm just going to reflect back on a conversation I had last week with somebody who has been representing disability cases for 16 years. She actually worked for the Social Security Administration. And I had a conversation with her, Mark, and she did not understand Medicare. Like Medicare, she knew there was A, B, C, and D, but she didn't understand the breakdown, like what A and B covered. She didn't understand what Part C was, that there was a Part C. She thought everything jumped to Part D. So let's just start with the basics. Like, if you could, a brief explanation of A, B, C, and D, that would be great. The reason why is I don't want to presume anybody out there understands based on what happened to me last week. Make sense?
Right, yep, makes total sense. So Part A is, well, first, the original Medicare is Part A and Part B. Part A is the hospital side of Medicare, and a lot of people think that Part A covers everything that happens when you're in the hospital, but that's not true. Part A is really more of a facility fee. It's your right to be in the building, use some of the services, those sorts of things, but it doesn't cover any of the medical care. That's all covered under Part B. So Part A covers inpatient hospital for the facility fee. It also covers skilled nursing, a skilled nursing facility if you have to go to a rehab or skilled nursing facility after you leave the hospital. And Part A also covers some home health benefits. Part A for most people is an entitlement, so there's no premium. They don't have to pay anything for it each month, and so it doesn't cost them anything. Part B is the medical side of Medicare, so that covers everything related to diagnosis and treatment. So that would be doctor's office visits, surgery, blood work, labs, all those sorts of things. And there is a premium for Medicare Part B for most people. Most people in 2020 will pay $144.60 each month, which is automatically deducted from your Social Security income. If you're not paying, or excuse me, if you're not drawing Social Security, then you have to cut a check quarterly to Social Security. If you make above certain income thresholds, you'll pay more than $144.60, and if you make below certain income thresholds, you will pay less than $144.60.
Mm-hmm.
Now, I'm going to skip ahead to Part D. So Part D is the prescription side of Medicare. So that, so Part A and B do not include prescriptions. So Part D is a standalone prescription drug health plan that you would pay a premium for. Of course, if you're receiving Medicaid or other financial assistance from the state or federal governments, you won't have to pay the premium. But most people will pay a premium for Part D. And then in addition to the premium, then they have co-payments for most or all of their prescription drugs. And of course, that varies based on the drugs that they take as well. Now, what Part C is Part C is a combination of all three, Part A, B, and D. So you've got your hospital, your medical, and your prescriptions all rolled into one plan administered by a private insurance company but funded by the federal government. So rather than carrying your Medicare A and B card and carrying your Part D card, you would just carry one card for your health benefits and your prescription benefits, and that's all you need. And then rather than paying all the deductibles and co-insurances for Part A and B, now the insurance company will pay most of your bills, and then you have co-payments that you have to pay to cover what the insurance companies don't.
Mm-hmm.
Now, Part C plans, which by the way are also referred to as Medicare Advantage plans, often include many additional benefits that original Medicare does not include. Some of those benefits, not always, but some of those benefits include dental and vision, an over-the-counter benefit where you can get over-the-counter items, a credit every quarter, every month for certain items that you might get over-the-counter at the pharmacy at no cost to you, a gym membership, transportation services. Some plans include meal services after you've had surgery, a nursing hotline, etc. A whole bunch of different additional benefits that original Medicare doesn't cover.
And so just to recap, A, hospital, B, doctors, testing, labs.
Anything that, B is anything that the doctor needs to do to figure out what's wrong with you and then treat it, whether that's surgery or other types of treatment.
Right. And then jumping ahead, D is drugs, and then C is a combination of all of them with a bunch of extra benefits.
Correct.
Good. Okay. So that's the Medicare program and the benefits and the brief breakdown. Let's go through the eligibility. And I'm going to put up on my screen right now I'll call it the obvious population that is eligible for Medicare, and those that have reached full retirement age. So that would be one segment when somebody reaches full retirement. But there's a part that people don't understand clearly, which is the disability component, Mark.
Right. So the way that so there are basically two ways to get Medicare. The first one is to age in to Medicare. So people that are 65 years old and older, or they're retiring. You don't have to take Medicare when you're 65. If you continue to work, you don't have to take Medicare until you decide to retire. You could be 95 if you want. But so that's obviously the biggest group of people that are eligible for Medicare. But then there's also people that have been deemed disabled and unable to work by a court of law. And those people at that point, begin to receive Social Security Disability Insurance, SSDI. And once they've received 24 payments of SSDI, then they automatically qualify for Medicare. And in some cases, there's a waiting period as well. But sometimes they receive all of those SSDI payments as a lump sum because it just depends on the onset date of their injury or illness. And so, but people that are disabled after they've been disabled for a certain period of time are then automatically eligible for Medicare.
You know, you said something that I really liked, which is after 24 payments, you become eligible. That is a very easy way to explain it, rather than, you know, you get, because there's a lot of variables involved, but thank you.
Yeah.
That's good. Okay, so you've got 66 some odd million people that are Medicare eligible in the senior retired market, and then the market that I serve here at the Disability Digest, and you mostly work in, is the disability recipients, which there's an estimated 9 million in that market. Of which 182,000 as of this recording are members here at the Disability Digest. So we're going to learn more about that as we roll forward. So the next thing is for disability representatives. What I'd like to discuss is the unique opportunity that somebody that is in the Social Security disability representative, attorney, non-attorney position has in this marketplace. Specifically, this. If somebody turns full retirement age, as I've learned from you, they basically get bombarded with marketing. But over here in the disability space, they don't. So how do you help people understand that when you're talking to disability representatives about the opportunity? Like, what is it that you say, or are they obviously aware of this? Perhaps if they were, they'd be doing this. But how can you help us understand that?
Well, so the reality of it is that most Social Security disability representatives or attorneys for a few decades have kind of considered the process to be this. Someone comes to them, they're injured or they have an illness. The SSDI attorney takes the case, they help them win their case, they get their SSDI, and then that's the end of it. And oftentimes after they win the case, the attorney or SSDI representative does not, that's basically the end of the relationship with the client. And so what we've been doing for the last number of years is trying to change that process and making the process go from they meet the client, they help them win their case, they help them get their SSDI, then they qualify for Medicare, and then they help them maximize the benefits they're entitled to under Medicare. And the reason for doing that, we call it completing the circle of service. So someone came to them because they're sick or injured, and they can't work, but part of that illness and injury is that they need health insurance to help pay for that. And so the SSDI ultimately provides them with that pathway to do that through Medicare. But then, of course, Medicare is really expensive with the 20% coinsurance, no prescription drug coverage, large deductibles. And so there are health plans available to these people that start receiving SSDI. And it's sort of a no-brainer for the attorneys or someone within the attorney's office. It doesn't have to be the attorney, him or herself, or the representative, him or herself, but it makes sense to help them access the Medicare benefits they're entitled to. So where the SSDI rep or attorney has a unique situation is that they are really the only people that know that these clients of theirs are receiving Medicare. Because like you said, if you're turning 65, you'll get bombarded with mail, phone calls, although you shouldn't be getting phone calls because it's actually technically illegal, but cold calling people on Medicare is illegal. But if you're on SSDI and you're going on to Medicare, you're 45 years old or 50 years old, nobody knows that the insurance companies don't know, other insurance agents don't know that your client is going on to Medicare, but you know that because you've helped them get there. So you're in a unique position to help them. And most SSDI recipients don't add any sort of Medicare plan without help because they don't really either think about it, or the TV commercials for Medicare health plans don't really resonate with the SSDI beneficiary because they're seeing 65-year-old people running on a beach on TV, and it doesn't really resonate with them, and so they might not do anything, and they don't even realize that there are these other health plans available to them, and that's why the SSDI attorneys or representatives are in a very unique position to be able to help these people.
Yeah, that's a great explanation. Actually, if you, for those of you listening, if you look up on the screen now, this is a common theme from a Medicare company that would work in the over 65 market, and then this one right here is somebody in a canoe. Now, I know from the members that I have here at the Disability Digest, the number of those that would be in a situation to go out in canoe is probably like less than 3%. So that's a good point. For those of you listening, this is the challenge that I had and why I started doing this. I avoided getting deeply into the Medicare business, frankly, full disclosure. And I tried to send our members who had Medicare needs to other companies. And to back up a bit, we are commonly contacted by people that are struggling to make ends meet on a disability check. And one of the biggest challenges that they're faced with is their health care cost. So we partnered with companies, and we'd send our members over to companies, and some of the big companies we had running agreements with 4 of them. But what would happen is this: they would go in and they would contact and they would speak with the agent there who was an over 65 trained agent, was not familiar with the nuances of an individual that is on disability. And our clientele that we work with commonly has 7 doctors and 15 medications. It's just the way it is. Somebody that's over 65 retiring could be fine. They might not have any challenges. So to try to get all of those doctors and medications into one plan has been a challenge. So our efforts were not successful in partnering with other companies, although we tried to work and educate their agents and do all that. It just did not work, and it wasn't of value to our members. Minimal value, I should say. So, and oftentimes they ended up on the wrong plans, and they weren't properly insured, and so it wasn't successful. So here I am. That's why I did this, and I think for people listening, if you're in, like Mark said, if you're in the business of serving your clients and completing the circle, this would be of benefit to them. And on the screen, now I'm just going to give you an example of like what I would consider a very mild competitive market situation. And I don't know if you can see this whole thing on the screen, but I recently worked with somebody in Iowa. And classic example, multiple doctors, multiple medications, and she had contacted us. She said, there's 11 plans. I don't know which one to get. And I wasn't aware that she was becoming Medicare eligible, but she'd contacted us. So in that situation, we went through, we took our doctors, we blended them into the plan, and we said, this is what we would recommend based on this reason. You can still see most of your doctors, etc. So that's the challenge that people have that are going through this, is once they become eligible, I don't know about you, Mark, but most people that I talk to, they want to keep their doctors. So how do they keep their doctors, try to get them all into a plan when most markets have, I don't know, 25 options for plans? So that's the issue.
Yeah, so one thing I want to just touch on, just going back just a couple minutes, when you were talking about the complexity of SSDI, Medicare versus the turning 65, and how the turning 65 agents struggled a little bit because of the nuances with SSDI. And I think that you're absolutely correct there. But one thing I do want to mention, though, is that for insurance agents that are able to help SSDI people with their Medicare benefits, those agents to be able to help people that are turning 65 with Medicare, it's super easy at that point. It's kind of like if you can handle the more complex, and also let's be clear too, though, that with some training and a lot of support, becoming an expert, so to speak, in the SSDI Medicare market, you can get there pretty quickly. There are a bunch of nuances, but it's not an insurmountable task. But what happens with a lot of agents that focus on turning 65 Medicare beneficiaries is that it's pretty simple, and so they just focus on that. And then when they run upon someone that has SSDI, then they can, like you said, they can sometimes lead them down the wrong path because there are more nuances and different things going on. Whereas once you're proficient in the SSDI market, you can also help people that are turning 65, and it's super easy. So, so that's good to keep in mind, that your Medicare enrollment, as someone that focuses in the SSDI market, your Medicare enrollments will reach far beyond your SSDI beneficiaries, because all of those people have friends and family members that are 65 or older that also have Medicare, so you can help them as well.
Yeah, great point.
Getting back to your other question, though. So yeah, I mean, occasionally, it just depends. When there's a lot of these Medicare Advantage plans have large physician networks, and so more often than not, most of the doctors end up being in one network or in multiple networks, and then you have the choice of many different plans. But yeah, I mean, it is a reality that sometimes the doctors aren't in the network, or maybe they've got 4 doctors and 3 of them are in the network and 1 of them isn't, or maybe they see doctors that don't take Medicare at all, or maybe they're not even doctors, maybe they're nurse practitioners, or maybe they're social workers or something like that they go to for therapy, and those people don't take any Medicare health plans to begin with. So we just have to do our best, and if they have really 2 choices. If their doctors aren't in the network and they're not in any network, they have 2 choices. They either stay with original Medicare and add in a drug plan, and then they're paying those large deductibles and co-insurances, or they switch one of their doctors or a couple of their doctors and end up paying a lot less to go into a health plan. And so really what our job is, in my opinion, is just to explain the options. And we don't steer or guide the clients into a certain direction. We just explain, okay, these are your options here. We've got these health plans, but this doctor over here is not in any of the networks. So you're either going to have to pay out of pocket to see that doctor, or you change doctors for that one specialty that you're going to. And more often than not, people choose to change doctors. I mean, a lot of people are incredibly attached to their doctors. Surprisingly, other people aren't. So we just have to do our best based on the tools that we have. And We can't make miracles. We can't get a doctor into a physician network overnight. Medicare Advantage plans have been around so long now, 16 years or so, that, if doctors aren't in a physician network, there's usually a reason for it. 10, 12, 13 years ago, the insurance companies were kind of pushing us to say, hey, if you come upon a doctor that's not in our network, you should try and get them in our network. But they're not saying that anymore because the plans have been around long enough that the doctors are usually not in the network for a very specific reason.
Yeah. I just want to bring up one point before we move on to like the marketing and the money piece, which is I have found that some people say, well, it's still I don't see a clear option. I'll just hold with Medicare A and B. I want to share this situation that we had here. This lady called us crying. Her name was Doris. She'd had a diabetic heart attack, and she was just on Medicare A and B. She had to be airlifted to a hospital, and she spent 4 days in ICU there. Her bill was $84,000. So in Medicare A and B, Mark, how much is she going to pay for that?
What was the total bill?
$84,600 and something.
All right, yeah, so she's going to pay about $17,000 plus.
Yeah.
Plus her Part A deductible, so about over $18,000.
Yeah. So she's like, I know you, I know you told me about this, but it actually happened. I felt awful. There's nothing you can do. So for one of the things that I look at for people is to cap their catastrophic out-of-pocket. Like, and if you're looking at the screen right now on the right-hand side, it says $4,100 out-of-pocket. And let's just use that as an example. If Doris was in this plan, she would have been capped, could have been capped at $4,100. Let's just put it that way. I don't know all the details of the plan. So that's one huge thing for people on a fixed income is to address that, and that's part of the service that you provide to them. So, okay, so most of our audience is attracted to and is a fit for Medicare Advantage plans because there's low to no premium, like you see with the example on the screen. So where I'm going with this is when talking to potential agents, they're like, okay, you mean to tell me that somebody gets in this plan, they get all these benefits, they don't pay anything for it, and then we get paid? How's that work? Can you explain that to the audience, Mark?
Yeah, so firstly, it's not too good to be true. The insurance companies are making money hand over fist. And the reason for that is that they can manage the benefits better than the government can. And the way that these insurance companies make money is that rather than Medicare paying 80% of every bill, what Medicare does is they contract with insurance companies, and we've got Aetna on the screen, so I'll use Aetna as an example. So what happens is that if this client or this Medicare beneficiary in Iowa, wherever this town is in Iowa, I don't remember, it's not on the screen anymore, but nonetheless,
yes,
this person goes and they look at their Medicare options and they choose to enroll in this Aetna plan. So now, rather than Medicare paying 80% of every bill for this client, they're sending a lump sum amount of money every month to Aetna on behalf of this client. So now, the client still has their Medicare benefits, but they're no longer administered by the federal government. They're administered by Aetna. And so now Medicare will no longer pay any of the bills for this client. Aetna's going to pay all the bills for this client, and then the client has to pay some co-payments. Like we see on the screen here, about halfway down in the middle, or two-thirds of the way down the middle, we see a $40 co-payment for a specialist.
Mm-hmm.
So if the client goes and sees a specialist, Aetna's paying the entire bill except for $40. So that's how it works. And if you think about everybody that's over 65, which is, of course, the primary Medicare market, most people are very healthy. And you've heard the saying probably many times over your life that 80 or 90% of your lifetime medical expenses are paid in the first and the last year of your life. So most people are healthy, and therefore most people on this Aetna plan are healthy, and so Aetna is banking money paid out by this client or paid out by all their members or on behalf of their members by the government every single month, and that's how the insurance companies make money.
Mm-hmm. Mm-hmm. Yeah, and I've been following this closely for, it'll be the third year, but it seems to me when they release the new plans, they're getting more and more competitive, meaning they're adding more features that I see, which gives me an indication that they are, like you say, making money hand over fist. So, yeah.
Yeah, well, so years ago, a lot of these health plans, at best, they may have included a little bit of vision and dental, and then they added in the fitness benefit, and then they started adding in the over-the-counter benefits and transportation benefits and a lot of other things, because all of these things are designed to attract members to the plans. So yeah, they're really, these insurance companies, and also if you've been sort of even casually paying attention to the news over the last 10 years, you know that a lot of these insurance companies are all buying each other, and that's because there's such a huge profit margin. I mean, while many massive nationwide insurance companies are dropping out of the Affordable Care Act, at the same time they're buying up little Medicare Advantage companies because it's huge business.
Mm-hmm. Mm-hmm. Yeah, it's kind of exciting. So we've talked a little bit about some of the extra benefits that are available in Part C, but there's a few that I just wanted to make note of to make sure that we cover that are helpful to the audience out there. And one that we have been attempting to leverage a lot is call it a Part B buyback. So you've mentioned the other ones, the gym membership, shopping credits, telehealth, but the Part B buyback, that's one that we missed. So could you give us an explanation on that?
Sure. Well, firstly, the Part B buyback is only available in relatively small percentage of counties around the country. So that's not a benefit that I would bank on having for your clients, unless you're in South Florida or some other places. Whereas
Texas.
Some of the other benefits are pretty common. Yeah, exactly. So the way the Part B buyback works is that a portion. So if you recall from 25, 30 minutes ago or whatever, we talked about the Medicare Part B premium, $144.60 for most people.
Right. And
some of these Medicare Advantage plans will actually cover that or cover a portion of that $144. Maybe they cover $90 or something. So now the Part B premium is only $54.60. So it's a benefit where the clients are literally saving money from their Medicare Part B premium each month, just as a benefit of the plan. So even if they never use the plan at all for health issues because their health is perfectly fine, they can still take advantage of that Part B buyback. I mean, just for simple math, if the Part B buyback's $100 a month, they're literally getting $1,200 put in their pocket every year,
right?
Or for that calendar year. Plus, they have the dental and vision and over-the-counter benefits. I mean, there's a lot of extra benefits they can take advantage of, even if their health is fine.
Mm-hmm. Yeah, there was an example of an individual in Florida that was on a Humana plan, and then Humana came out with a new plan, almost identical to the one that he was on, but it had a $90 per month buyback. So it's a simple sliding from one plan in one company in the same company over to get the buyback. So I think the message that I have for people out there is part of this retention piece and customer service is to, once you're familiar with your market, is help people be aware of, what's going on for changes. Okay, so that's great. So let's move on to what is involved in getting involved. If somebody is listening to this as a non-agent, and wants to become an agent so that they can do this business, what are some of the key things that they need to do, Mark, to get in the game?
So the first step, of course, if they're not licensed, would be they need to get an insurance license, life and health license. And so the life and health license varies in name from different states, but sometimes it's an accident, life and health, or accident and health. But nonetheless, so the first step would be to study for the test. Most states require you to take a pre-licensing course before you're able to take the state insurance test. That pre-licensing course, most people, I would say 99.8% of people take an online study course, although there are face-to-face study courses and study courses that you can purchase books to study, but most people take an online course because they have sample tests and different things. Some of them have guarantees that if you pass their final test through the online study course with a certain percentage, like 85% or something, then if you go on and fail the state test, they'll pay for you to retake the state test. Although I will tell you that very few people, in my experience, fail the state test. I mean, we've had hundreds upon hundreds upon hundreds of people go through the state testing around the country, and very few people fail. But anyway, so once you've taken the pre-licensing course and then taken the state test, now you are a licensed insurance agent. Now keep in mind, though, that the state test and the information that you'll study covers many different parts of life and health insurance. It's not just Medicare, because it's a fairly broad test. So you'll learn about the Affordable Care Act and different things, all of which you can immediately forget if you're going to be focusing in the Medicare market. So once you have the state test, then you would contract with insurance companies, and that's what we do. So we would help you there to make sure that you're contracted with all the relevant plans in your area. We were looking at Iowa earlier. There are 11 plans. That doesn't necessarily mean there are 11 companies. Most often, insurance companies offer multiple plans in the same area, but also sometimes insurance companies aren't relevant. So you might not ever sell that plan, so it might not make sense to contract with that insurance company, and so we help you sort through that. And then once you are contracted with the insurance companies, then you have to do government-required Medicare training called the AHIP. It stands for America's Health Insurance Plan Training. It's a Medicare Basics Fraud, Waste, and Abuse training. We can help you with that. And then the insurance companies themselves have carrier-specific training or certifications, and it's basically just a training to learn about the products that you'll be selling, which is obvious. I mean, if you're selling cars for Honda, you're going to have to learn about Honda cars. So it's the same thing with Medicare insurance carriers. They require you to learn about their plans, and we can help you with that as well. And then at that point, you are deemed ready to sell. You also have to purchase errors and omissions insurance, and we can help you sort through that as well. But then you're ready to sell, and you can start marketing these health plans to your clients. But there's also additional training that we can help you with sales training and support and different things to really get you through the process so that you're an expert in the Medicare market, and you know exactly what you're doing and how to best serve your clients.
Mm-hmm. Good. So let's just recap. Prep for the test, pass your state insurance exam, and you go to a testing facility to do that. For those of you that are out there listening that are Social Security, Disability, non-attorney representatives, and you know that testing process, it's nothing like that. You can go right in your local community to a test center. So once you pass the test, I don't know which is next, AHIP or carrier certification, but they both need to be done, right?
Yeah, so it's contracting with the carriers, and then the AHIP, then certification.
Okay, yep. Yep. Okay. So once somebody passes their test, Mark, what would you set some expectations for? You pass your test today, when would you be ready to sell on average?
Well, so like many other things in life, it just depends on how much time you're able to put into it. So if you were to, so firstly, all the insurance companies do background checks, and so that can take a few days, but we can be working on the certifications at the same time, so we're not really losing time. But usually, I mean, with the large national carriers, usually they're pretty fast. So it can be within a working week or maybe even a calendar week. You should be ready to go. Some of the smaller carriers can take, longer, 10 days or more to get the background check, but they're getting pretty quick too. Now, it also depends on the time of year. So there is the Medicare annual enrollment period, annual election period that runs from October 15th until December 7th. And so as the closer we get to that, so August and September, oftentimes many insurance agents are entering the industry, and as a result of that, the insurance companies just have more background checks to do, so it slows things down.
Mm-hmm.
But if it's earlier in the year, they're usually pretty quick. Now, one thing I do want to mention that is a very common question is for agents that want to sell insurance in multiple states. They often ask, do I have to take a test in every state where I want to sell Medicare plans? And the answer is no, for the most part. You don't have to take a state insurance test. Once you have your resident license in your resident state, you can just purchase a non-resident reciprocal license in any state in the country without having to take another state insurance test.
Mm-hmm.
So you just have to pay a fee. You just have to pay a small fee. The fee ranges from a few dollars up to maybe $100 or more depending on the state.
Mm-hmm. Okay. So there is a process. I mean, basically you're setting up an insurance structure, whether it's an individual agent or an agency. So, okay, that's helpful. Let's move on to the next part, like finding customers, marketing, and I'm going to break this down in a few different areas. Somebody that is coming here, maybe they're a CPA, accountant, a disability representative, or just maybe you're a current agent or you want to become an agent. Those are the three categories we're cover. So for somebody that's listening that is not in the disability space, they're a CPA, they're an accountant, I mean, is it as obvious as their existing client list, or what's your advice to those that have an interest in considering this?
Yeah, so I mean, most professionals, in any of these types of industries often have a database with their clients, and oftentimes in that database they will include different things about the clients, including their birthdays, and oftentimes those databases are searchable, or depending on the size of the accounting firm. I mean, many accountants know most of their clients, off the top of their head, or they can, just by seeing their name, they know if they're 35 or 65.
Right.
But yeah, so mining the book of business to find people that are Medicare eligible. Obviously, if they're SSDI attorneys or non-attorney reps, that's often easier because everyone's eligible or will eventually be eligible for Medicare. I mean, every CPA client is going to be eligible for Medicare too. It just might not be for 25 years, depending on the age of the client. So, just mining that book of business, but also, a big part of being successful really in any industry is letting clients know what you do. It's why State Farm Insurance advertises all the time that they do life insurance, because a lot of people think of State Farm as being home and auto insurance.
Mm-hmm.
They don't think of them as being life insurance agents, and so they think, oh, I need life insurance. They don't immediately think of their State Farm agent. They think they need to go look somewhere else. And it's the same thing with this with Medicare. So if the CPAs or accountants or other professionals just start letting their clients know this is a new service they provide, they will start getting business.
Mm-hmm.
Sending out letters or emails or advertising, if they do radio or TV ads, putting in a little blurb, or their hold music. If they have, a lot of people, when a client calls in and they're put on hold, they have the attorney speaking or the CPA speaking, or they have music, and they just say, hey, are you or anyone you know eligible for Medicare? We can help. Just passive, inexpensive marketing like that. It's a great way to get a lot of business, and really helping their clients understand that they can help anybody that has Medicare. Not just, you don't have to be a client of the CPA to receive Medicare help from the CPA. You could have a different accountant altogether, and still go to this CPA for the Medicare benefits. And what we find is that Medicare actually helps the CPAs or the financial planners or the SSDI attorneys, or non-attorney reps, receive more referrals for their primary business through Medicare. So, a new Medicare client comes in that doesn't have a CPA, and now they need a CPA, and now the CPA is helping them with their Medicare, and now they can help them with their accounting services as well.
And this is a referral from where, Mark? Possibly from Medicare, did you say? Or?
Yeah, so let's say, for example, that an accountant has an accounting client.
Mm-hmm.
And then that client comes in, and the accountant says, hey, don't forget, I can help you or anyone you know on Medicare.
Okay.
And say, oh, great, I need Medicare, or I'm getting Medicare, I'm turning 65 in 3 months, so yeah, I need help with that too. And then that client goes home and talks to their neighbor and said, oh, my accountant helps me with my Medicare, and the neighbor says, I'm turning 65 as well. And so then the neighbor goes in and meets with the accountant, and maybe that neighbor needs some accounting help as well and doesn't have an accountant, and now they have an accountant. So
I got you. It's a nice lead generation.
Full circle lead generation. Yeah.
All right. Is there a certain benchmark that you see of like potential sales where this, is of interest to people? Like if they say, oh, you know what, maybe I have 5 potential Medicare sales a month that's of interest, or do you have a sense for that?
It's really variable. I mean, everyone's a little bit different. We haven't really talked about commissions yet, but I mean, there's a lot of income opportunity here, and so some people are more than happy with an extra $500 a month, or an extra $500 a week, or an extra $500 a day, or
Yeah.
An extra $1,000 a day. It just depends. It just depends on how much time they have to put into it. But it's going to cost you, between getting licensed and getting errors and omissions insurance, it's going to cost you about the same as one enrollment to get started. So once you've enrolled one person, you'll have broken even.
Mm-hmm.
So anything beyond that's pretty much gravy.
Right. So let's move on to those that are working in the disability space: disability representatives, attorney, non-attorney, disability advocates, maybe even social workers. For them, it's like we discussed earlier, it's glaringly apparent when somebody becomes Medicare eligible, or maybe they already are and they just haven't had or been put on the right plan or have their options reviewed. So a few things here. When you are working with individuals in the disability space, how do you advise them to, what's the top thing you advise them to do? Like the number one thing that they need to put in place to make this a success?
So the question is,
so somebody's a disability attorney. Yeah, what's the number one thing? I think I know what it is, but I'm just curious from your perspective that they need to do to get a client to understand that they can help them and get them enrolled, get paid, etc.
Well, very, like I mentioned a couple minutes ago, it's very basic marketing. I mean, it's just a matter of letting them know this is a new service that they can provide. Letting them know that there's, in most cases, no cost to do it. They're just helping them maximize the benefits that they're entitled to under Medicare but might not know about.
Yep.
So just sort of creating awareness that this is something that A, is really important that the client take care of, and B, that the attorney or non-attorney rep can help them take care of themselves.
Yep, exactly. One of the things that we've found helpful here, and we've taught others to do, much to your direction, is that when you're working with somebody and they're going through the approval process, we educate them before that we do this service, but the moment that we have the award notice, then we are reminding them that we do this. And how we do that here is we have an award review meeting, and we send out, schedule an appointment. We want to review your award letter, make sure you got paid, you understand when you're getting paid, your back benefits, and then discuss your Medicare eligibility, understand your goals for Medicare transition, and then give you some advice for your plans. And they're like, when we get into those conversations, and I can say whatever I want, but unless you start doing this, you're not going to realize how easy it is and what a relief it is for people, because they're like, oh my God, I didn't know what to do about Medicare. Thank you so much. So, and because from the position of a representative, we have all their doctors, their medications, their treatment, you can do the work in advance. It's everything you need to know to get them into the right solution. So we have another unique opportunity we haven't talked about I want to touch on here in the disability world, which is the a special election period for those that have low income. So I'll lead you into this question with a little better direction, Mark. Most people in the Medicare business have a peak season, well, everybody does really, from October 15th to December 7th, the AEP period. But here, in this environment, we have individuals that can change plans basically year-round for the most part, with the exception of a few months. So would you explain that to the listeners and how that works and creates like an annual, consistent flow of business opportunity?
Sure, and I apologize for going back a little bit, but I just want to also touch on the point that from your client's perspective, Medicare is this massively confusing thing, and even for people that are turning 65, I mean, some people are so overwhelmed by it, they don't do anything because they think it's very complicated and confusing. And I mean, if you think about Medicare like a puzzle, imagine the first time you're going through Medicare, it's a puzzle, and maybe it's one of those puzzles that it's just one solid color, and that's it. And it's kind of it's confusing because there's no picture, and it's just hard to figure out where all the pieces go. But imagine if, as you figure it out the first time, you put numbers on the back of every puzzle piece, and then every single time you have to do it moving forward, it's super easy because you already know where everything goes. And it's kind of like that with us, is that the learning curve is steep, but then it plateaus really quickly, and it's super easy to help your clients. 95% of your clients are going to be in very similar situations, relatively speaking, to Medicare. And then there's 5% outliers, and I mean, we're here to help for those 5%, but most of the time it's just going to be plug and play once you kind of get proficient at it. So it's not this big complicated machine that most people assume it is. Now, you're asking about
special election, annual business transactions, changing plans, making money year-round.
Yeah, so there's a couple ways to the two primary ways for to enroll people in Medicare is either they're going on to Medicare for the first time, so they're aging into Medicare, or they're becoming eligible due to SSDI. And obviously that happens all year round because people turn 65 or they become eligible for Medicare all year round. Then there's also the annual election period, which is October 15th through December 7th, and that is when everyone that is currently on Medicare is eligible to add or change their plan, depending on what type of plan they have, Medicare Advantage plan, drug plan. They can add or change during those windows.
Mm-hmm.
And so obviously that 7-week period at the end of the year is a pretty busy time, but that's not really that shouldn't really be the busiest time for most people, because there are options to help your clients year-round. And so other than aging in or the annual election period, there are also people that have low-income subsidy or Medicaid. If people have low-income subsidy or Medicaid, they're able to change their plan every quarter. And so those people, you can help them all year round. You don't have to wait until the annual election period. There's also other special election periods for people to help them change their plan based on new circumstances occurring in their lives. Those circumstances might be moving. If they move from one area to another, one service area to another, which is oftentimes with Medicare, a service area is either a county or a state, but they're moving from one county to another, they qualify for a special election period because they've moved. There's also people that go on to or come off of Medicaid, or people that have gone into or come out of a nursing home or skilled nursing facility, or people that have lost their work coverage or other credible coverage because they're retiring or their spouse is retiring. So there are numerous special election periods that provide for a year-round business in the Medicare market.
Mm-hmm. Okay, great. So we're talking about customers and how to find customers, and coming up in a few minutes, we're going to, if you're in business and have a disability representative business, we're going to give you kind of a benchmark to determine what the value of your business is. But for those of you that are listening that might be, maybe you're an agent somewhere, or you want to be an agent, and you're looking for customers, and you don't have any, we're definitely looking for people that want to come here, work as agents here at the Disability Digest, and I'm going to show you towards the end of the program more about what we have for tools to offer. But the short story is we assign somebody in a geographical area of business or a category of people, and I'll use Texas as an example. We have 6,107 members there, and you might be working in Texas by yourself or on a team, and it is to call and help people understand how you can maximize their benefits, and eventually, ideally, convert them into a customer of ours. So if you were to work in Texas and that was your one and your sole and your only job, and you converted 4% of those over a couple of years, then, you know, we're going to talk more about commissions in a few minutes, but that's like $5,000 a month in revenue that you would generate conservatively. And that doesn't just apply for somebody who's an independent agent. We're working with disability representatives now, where we have the same structure. They manage their own business, they have their own clients, they have staff that has extra time, they're looking to expand their insurance side of their business, and so they take this position as well. So there's lots of opportunities here to fill that, you know, customer void here at the Disability Digest, which is why we get into this business. So Mark, back to you. Who's a good fit for this, or maybe who is not a good fit for this? Do you have anything to share, you know, maybe help somebody understand if it could work for them or not work for them?
Who's a good fit to be an insurance agent in the Medicare market?
Yeah.
So, I mean, obviously, you have to have good people skills, I would say. I mean, oftentimes people come in and they're looking for you to calm them down because they're stressed out or they're really worried about this, and being able to discuss Medicare, you know, in a very intelligent way, and in a way that you can explain something that's complicated in a very simple way. And these are things that we teach you how to do, but being able to do that and having compassion for your clients. I mean, a lot of people, especially with SSDI, I mean, they've got some pretty traumatic experiences that they've gone through, and being able to be compassionate towards them is key. Being able to create your own working structure is important. It's really a self-starter business in the sense that, you don't have to, well, I guess it depends on your work setup, but I mean, a lot of agents are able to work from home, or they're able to have flexible schedules, which is really, it's a great responsibility, but can be, but it's so rewarding as well.
Right.
So, I mean, if you have, 20 clients that are eligible for Medicare, many of them are not going to call you. You have to call them or get in touch with them, unless you've set up some sort of, a very straightforward process where your clients are very much aware that when they get their Medicare cards, or when they receive notification from Medicare, that they call you immediately. So that's really the ideal situation, that you're generating inbound calls, but being able to work on your own without someone necessarily telling you, it's time to go to work and it's time to do this, it's time to do that. I mean, that's really the key to success. If you're a good self-starter and you can motivate yourself, especially in the SSDI market, though, I mean, there's not a ton of motivation required because there's just so much business to be had, and very little competition. Whereas in the turning 65 market, if you're focusing on turning 65 market and you're brand new to the industry, you have to hustle pretty well to start generating leads for yourself. And if you already have a built-in book of business, whether you're a EPA or an attorney or a non-attorney rep or a property and casualty agent, I mean, it's a lot easier to find those clients. So, but just someone with a positive attitude, someone that wants to work hard. I mean, the harder you work, the more people you help, the more money you make. So it's,
Right.
The world is your oyster.
Right. Well said. One thing that I definitely want to add to this, for anybody listening out there that might be a disability recipient, or you're working in the disability space. My experience here at the Disability Digest is I've had people work and run this business, most of the operations, since 2007. And working and contacting those that are going through the disability process, it's worked successfully. But there's a lot of time-sensitive work there, and people with limitations and disabilities, it's not really a good mix. But I have met not a lot, but I've met several that are on disability, that are insurance agents, and this is the direction that we are going, is to help people supplement their income. I feel it's a really good fit because of these reasons. You can work at this, like you said, Mark, you have your own schedule and you can control it. In this work, it's not super time sensitive. You need to get things done, but you can manage that. So somebody that has a disability or a limitation or something like that, or even somebody that might be a stay-at-home mom, I think this is a wonderful fit because you get the upfront commission and the residual component. So that's it. But for people that are on disability, I have met and interviewed 2 individuals within the last few days that have over $2,000 in residual income from Medicare residuals, and they are Social Security disability recipients. One of which is on our YouTube channel. He went through the entire approval process with over $2,000 in residuals and was awarded by the judge because that income is deemed as passive income for work that he's done in the past. So it doesn't have an impact against his SGA. So a few things here. In this business model in insurance, certainly managing your own business is great, but making a difference to those that you serve and offering the opportunity for them to become an agent is another piece that I encourage all of you out there that can do it should do it. You know, provide them with part of your business and have them become one of your agents. So that's an idea that I wanted to add in here. Okay, so we're going to flow into like how much you can make. So let's start with this. Back to the Iowa example. Somebody gets enrolled into that Aetna plan. Mark, how does the commission work? Like first year commission, etc.
So firstly, in most states around the country, the first year commission is $510. That varies a little bit depending on the state that you're in, and the maximum is in New Jersey and California, and it's $636 in 2020. Every year, for the most part, the commissions increase, so you do get a little bit of inflation protection with your renewals, because most companies will pay the increasing renewal amount as well, so it's kind of nice. So $510 first year in most states, $636 in California and New Jersey, and then there's a couple others. Pennsylvania, DC, and Connecticut pay $574 first year, but then you get half of that as a renewal every year beyond that, as long as the client remains on the plan. So $255 in most states, and then $287 in Connecticut, DC, and Pennsylvania, and then $318 in California and New Jersey. So that's in most states $255 every year, and that usually, like I said, that usually increases every year. So a minimum of $255 every year, as long as the client remains on the plan. So you could literally be getting paid more than $255, considerably more potentially 10 years from now, for a client that you enrolled this year. So those residual incomes, that residual income can build really quickly, even if you're only doing a small number of applications.
Okay, so let's go through like earning individual for excuse me, an earnings projection for just an agent, and then we'll do an example for a disability representative that I have for us today to kind of give somebody an understanding of the value of their business. But if somebody was to come and start, and in their first year, let's do a real conservative example and say that they had 15, or let's say 10 new customers, new to Medicare customers in the first year. Super part-time, extremely passive. Their earnings on that, based on what you're saying, would be $500 each, roughly?
$510, yeah.
Okay, so that's $5,010, right? So they're working part-time doing that. If they're working more than...
Yeah.
Okay, so, and then the second year, they do the same amount of business the second year, so they would get that same 5,000 roughly, right?
Yep.
And then using the example of the residuals at 250 some odd each, they would also, let's say that they would receive that in the second year, right? So they get 5,000 and then 2,500 roughly, 7,500.
Yep.
So then the third year, same example, it's going to go 5,000 plus the first year commissions, second year commissions, so it'd be about 10 grand, right?
Yep.
Okay.
So in 3 years, you've doubled your income by your growth has been linear, but your income has doubled.
Yeah. So I had somebody that worked here last year that was on disability, and she was able to be on the phone 3 hours a week, and that's about how much business she generated in that time on 3 hours a week working here at the Disability Digest. So that'll give those of you a super conservative estimate of what is possible to do. So let's move on to a disability representative, and I have an example of, this is an actual live business that we worked with. We had an individual that had 900 cases on the books, about 35 a month. We're going through the process of getting approved. So it's 35 awards a month. So we forecasted that 25 of those clients a month would be Medicare customers, would become Medicare customers. So in looking at that 25 a month, that's 300 clients the first year. Now, I know from the work that you've done, maybe, I don't know if you've had somebody that has done 300 in their first year. Maybe you have, I don't know.
Yep.
You have? Okay.
Oh, yeah.
All right. So this has definitely been done. So that would be 300 clients in the first year would be 150,000 in first year commissions. Then the second year, similar to the example that I used before, the 150,000 plus the year one residuals would be 225, and then going down to year three, the combination would be 300. I'm just going to cut to the bottom line. Year four, 375,000. Year five, $550,000. So somebody has, and there's a lot of disability practices out there that have 900. But if you maybe have half that, then you can look at your business and cut the numbers in half and say, okay, year five, I'm going to have $250,000 added to my business. All right, so your cost of operation is, to do that amount of business, you need 1, 2, 3 agents. If you're doing 25 a month, can you do that with one agent?
Certainly. I mean, it just depends on how much time they have and what other responsibilities they have within the office. But yeah, I mean, one agent can easily do that.
That's a plan a day, really. I mean, maybe 2 a day. And the enrollment process is not that long, so I agree. So if you're out there and you're in the disability business, I hope that this has given you an idea of what the income possibilities are. If you're somebody that's just getting started from absolute scratch, the example of the 1 through 3 year earnings of $10,000 a year is hopefully that was helpful. So somewhere in between. Last thing I want to talk about before we wrap up is the retention. And in your position, I know you do some business yourself, you write some policies, but you also have this vast network of agents. So from a retention perspective, I would expect that you can look down on all of these active policies and speak to, like, what's the retention like? How long does a customer stay on? Like, what can somebody expect?
So, especially in the disability space, it is, well, really any time that the client has a relationship with the agent to begin with, whether it's an attorney, a non-attorney rep, property and casualty agent, financial planner, accountant, whatever, the retention rate is incredibly high. I mean, it's 99%, basically 98%, because even if the client wants to change their plan, they can change their plan within the same agent by using the same agent.
Mm-hmm.
So
Yeah.
if they have, say, Aetna and they want to go to United Healthcare, well, you're going to have access to both of those carriers, so there's no reason for the agent or for the client to go to a completely different agent.
Mm-hmm.
So the renewal commissions continue in the event that you switch them to a different plan. You will not get the first year commissions again. That's only paid one time in their entire lives to the very first agent, but the renewal commissions will just continue. So it's very, very low. However, it also has a lot to do with how much energy the agent puts in. I mean, we recommend contacting your clients at least once or twice a year just to let them know that you're still around, but also to remind them that you can help anyone that has Medicare anyone that they know that has Medicare. So what, if you haven't talked to your client in 4 or 5 years, they're more likely to switch to a different agent or something like that. So the more contact you can keep with them, just to let them know, hey, I'm still here, I can still help you. If you have any questions, let me know, especially around the annual election period when they could be changing to something else. All of those little things are going to help with your retention, because obviously if you enroll them and never talk to them ever again, they're more likely to switch. So
exactly, I liken it to the difficulty that they have getting on is the difficulty that they have changing, and so that barrier is high. So if you keep the relationship, you'll be good. Yeah.
Yep.
Okay.
I mean, keeping a client for 10 years should not be too difficult. I mean, obviously you have people that pass away or they move to a state where you're not licensed and don't want to be licensed. But for the most part, people pretty much stick around where they are, and their doctors kind of remain the same and whatnot. And even if their doctors change, you can help them with a different plan if need be. But so retention shouldn't be too difficult.
No.
If you just do a little bit of work to remind them that you still care and you're still around.
Yep. Yeah. So as we wrap up here, a few things I want to talk about for those of you that may be interested in working with us as an agent, as an individual agent. I'll speak to that and then next steps for others. But here at the Disability Digest, whether you're on disability or looking to become an agent, we provide a turnkey system. I'll put some information up on the screen. Well, that's not it. But some of the things that we provide is really an endless supply of prospects to talk to. We usually assign you like a group of 4,000 to 5,000 to work with, so that'll keep you busy. We have a proven call process to call them. We have training and support. We have a phone system where you log in online and you would go to work online on a team. And we can provide you with, as you grow your business, we can even help you and partner you with somebody else that can provide office support. So you can do this year round. So you're really in a position to have what I would like to think is a turnkey solution for somebody that wants to come here, or if you just want to become a licensed agent and go out and find your customers outside of the Disability Digest world, you certainly can do that as well. So those are some of the things that we offer here. If you're a disability representative and you're looking to leverage and maximize your business, then we'd certainly love to talk to you. We work with individuals in a few different ways. We've got the great support of Mark. We have the support of the Disability Digest, where we can help you with coaching, strategies, marketing, and depending on where you are and what your business is like, we could provide you with disability cases to help you grow your business on that side so that you can get those approved and then increase your Medicare business. So there's a lot of options there. So I think a few key things in closing that I look at here is in my business experience, I've looked at a lot of different businesses, and I've looked at individuals that have tried to create products that have passive income. And maybe you have too, Mark, but it's not easy to find. Right? I mean, in our disability world, we're so much in the transactional business. Get a case, win a case, get paid. Get a case, win a case, get paid. It's different here. So there's really, it's a great opportunity to put some value in somebody's business, lifestyle, make a difference for people. That's it. Mark, listen, before we wrap up with the last steps, I want to thank you for taking the time. I know
My pleasure.
We've been on the line here for a while, and the good work that you do in helping people make a difference. So If you're interested in learning more about working with us here, we'd love to speak to you. Right below this video, there'll either be a form that you can enter your contact information in, or click on a link and navigate over to the form. And we'd love to hear from you, speak with you about the possibilities of helping you get involved in or maximize your Medicare business. All right, that's a wrap for today, Mark. Thanks for taking the time.
All right, my pleasure. Have a great day.